Again, I am Alexa Tinsley. I'm the Director of Programs here at Jett Foundation. We are so excited to share our community webinar series topic with you today, Fueling Strength Nutrition Strategies for Duchenne Muscular Dystrophy. I think that this is such an important topic and one we don't necessarily hear enough about, so I'm very excited to introduce you to Marla today. She's going to go over all of the things with you. Marla has been a registered dietitian for about 7 years. She completed her bachelor's degree in nutritional science from the University of Connecticut and a dietetics, I can't ever say that word properly, internship at the University of Massachusetts Amherst. So she has a slide, she'll introduce herself later, but I do want to let you know that she is part of the UMass clinic. So she is very experienced, very knowledgeable, so very excited to hear what she has today. There will be a live Q&A at the end, so if you do have any questions, there is a Q&A box at the bottom of your screen. It's like 2 boxes, says Q&A. We will primarily use that for answering questions, but we do our best to try to find questions from the chat. We do also stream this to Facebook, so if there are any questions that come in from Facebook, we do try to get to those as well. This webinar is being recorded, so if for any reason you have to hop off or you know someone that was not able to attend today that wanted to attend, please feel free. That link will be available to you after this webinar, probably today or tomorrow, for you to be able to view later. Along with that, closed captioning is available again at the bottom of your screen. You can click that CC button and you should be able to see the full transcript or live transcription as well. And I think that is all from me, and I will hand it off to Marla.
All right. Thank you, Alexa. Hey, everybody. It's so great to be here. Thank you for having me, and thank you for coming. Today, as Alexa said, we're going to talk about fueling strength, so how nutrition can impact Duchenne muscular dystrophy. So a little bit more about me, as Alexa introduced me. So I am a registered dietitian nutritionist. I received my bachelor's degree through UConn in 2017, and then I went on to do my dietetic internship at UMass Amherst and finished that in 2019, and then have been a dietitian since, practicing in a variety of settings. And in 2023, I joined the DMD program at UMass. And more recently, I became a certified diabetes care and education specialist. So great to have that as well. And as I mentioned, I have experience in a variety of settings, but also with different populations from pediatric, adolescent, and adult. Bear with me here. There we go. So just to give you a little bit of some background knowledge of the difference between a dietitian versus a nutritionist. So as you see here, a little chart comparing and contrasting. A dietitian does more recently need to get their master's degree. I am grandfathered in, as others are, with it previously being just your bachelor's, and it needs to be from an accredited program, versus a nutritionist does not need to have this degree or a certain degree. And then as a dietitian, we have to complete an internship, and this is with supervised practice. So this is in a clinical setting. We also have a community setting and food service setting. Versus a nutritionist does not need to have this hands-on experience. And then after our internship, we have to pass a registered dietitian exam. And the dietitian is going to provide medical nutrition therapy. So what that is, it involves treating certain nutritional problems or medical conditions. So nutritionists do not typically give this type of education, just general nutrition advice. And the dietitian can work in many settings. As I mentioned, clinical, community, food service, really all over, versus a nutritionist is more so in gyms, wellness centers, food companies, not usually more in that clinical setting. And I just want to share this so, again, everybody has that background knowledge, especially if any of you are looking for a dietitian outside of your clinic, just to be aware of those differences and make sure that you find the right fit for you and your family. So a little bit more about my role in the DMD clinic at UMass. Of course, I'm there to give education, and many families may say, like, we got this, we've been doing this for so long, no education needed. And I love hearing that. I do. And that is great, but I will still go in and do what I say is like my little checklist. So we're going to talk more about that today. Some just kind of general points we like to go through: protein, calcium, vitamin D, hydration, sodium, and carbohydrate intake overall, and then, of course, more individualized based on the person. And then in our clinic, it is such a team approach. The physical therapist may communicate to me fractures, and then I will discuss that more with the patient on calcium and the importance of those fractures healing. Weight loss or weight gain may come up, or starting steroids. So those are other areas that I most definitely get involved with. And then, of course, I'm there to be a support system, brainstormer, whether you or your child is a selective eater. We can talk about strategies behind that. Or if you just need like new food, drink ideas, whatever comes up, I'm here to help. So let's get started. Our favorite that we love to talk about is protein. So protein is our muscle building block. Protein also helps us stay satisfied longer. Currently, we do not know the optimum amount of protein that those with DMD need. However, there are some similar studies on certain populations that determine we need to increase that protein more than just the general population. So 1 to greater than 1.5 grams of protein per kilogram is what we recommend. And again, that's so individualized based on the person, age dependent, if there's any risk factors like kidney stones. At our clinic, we like to say greater than 1.5 grams of protein per kilogram is what we're aiming for. For this protein, there is so many different sources. So if you're not really into meats, no worries. As you see here, there's a lot of plant-based sources of protein: your dairy, tofu, edamame, beans, nuts and seeds, the list goes on. The important thing to note, though, is we want these proteins to have high biological value. So what that means is for the body, those are highly digestible. They contain all the essential amino acids in the right proportions for our health. So essential amino acids are actually compounds that our body doesn't create. So we actually need to get these from food sources. So most of the time, these are going to be from animal sources, but you can get them from plant-based sources. Just make sure that you or your child has a variety. So for example, making sure it's not just tofu, making sure there's quinoa in there as well, beans, nuts, seeds, just a variety of those plant sources so that you can get all those essential amino acids in. With the proteins, we do want to try to choose leaner proteins versus more higher fat proteins. Pork and beef tend to be higher in fat. Just limiting those, again, not avoiding altogether, but just limiting those options, or choosing beef that is more like 93% lean, 7% fat. Some challenges for folks with getting in enough protein tend to be if you get full fast, so early satiety, getting full fast at your meal, or depending on your meal schedule. So if you're fasting, or you're one that doesn't like to eat breakfast, you may miss a good opportunity to get a decent amount of protein in. So those are things to keep in mind that may limit you from getting that full protein that your body could use. Next is carbohydrates. So carbohydrates are our body's energy source, so we need them. But when any of us take in too much, our body ends up storing those for later. And then if we keep that pattern up of storing and storing and storing, that's going to contribute to some excess weight gain, insulin resistance, higher blood sugar, and some other medical conditions can occur. So it's our body's fuel source, but we do want to try to limit it. And usually I say to try to eat this food group last on your plate and try to have it be about a fourth of the plate. Other reasons to just limit those carbohydrates would be usually our energy and our mood are a bit more stable when we do. We usually don't have a crash afterwards. And usually there will be less of a bloating, inflammation, maybe less gassy, if so. We want to try to have more complex carbohydrates versus those simple carbohydrates. So what that means is the complex carbohydrates have fiber, and I like to tell people to look for at least 2 grams of fiber on the label per serving. So complex carbohydrates will have that fiber. A few examples would be like your whole grains, so more of a wheat bread, brown rice, wild rice, quinoa, farro, barley. Those are just a few examples. But again, why I say the 2 grams of fiber, at least the 2 grams of fiber, is because there are so many products out there now. So that's kind of a safe bet of, I would say honey wheat bread. No, but nowadays they make so many different products. So if you can find that 2 grams of fiber, that's great. Versus our simple carbohydrates are the ones without fiber. And you can kind of think of that as the body simply uses that and then you may get a crash. So those would be more of like our white rice, white bread, more of those, again, white products, if you will. Another term that we sometimes use for the complex carbohydrates would be low glycemic index. So again, that's just a similar concept. We're choosing those higher fiber foods. They're usually slower digested in the body, and they help you kind of stay full for longer. Next, I love to discuss sodium and hydration. These two go hand in hand. So excess sodium is going to cause more inflammation. A lot of times you may notice like some puffiness in your face or in your child's face, increased inflammation, just like for general public, fingers can get swollen if we have too much sodium. So these things are increased even further with the use of steroids. So having excess sodium is going to cause more of that inflammation or that puffiness, and then also can increase the risk of kidney stones. We want to try to aim for around 1,500 milligrams a day. So if you kind of break that down, it's about 400 to 500 milligrams a meal, little room for some snacks in between. And I like to break it down because 1,500 milligrams, that's like, what is that? What's that looking like? So that can be helpful to kind of break it down per meal. If you know you're going to be going out to eat, that's going to have more sodium. Be mindful for the other meals. Hydration is going to be very helpful because if you do go out for a meal and there's a lot of sodium, increasing the hydration is going to help decrease that puffiness, kind of keep that sodium moving along. So it's going to help prevent constipation, overeating, again, decreased risk of kidney stones, headaches. You're just overall going to feel better when you have adequate hydration. And that is very individualized as well, the amount of hydration one needs. Next is our calcium and vitamin D. So again, hand in hand here as well. So calcium and vitamin D are so important for fracture healing, but just general bone health as well. This range varies to, depending on age, 1,000 to about 1,500 milligrams, give or take. This higher end is with steroid use. So I just want to point that out that we have to add a little bit more calcium with the steroid use. And sources of calcium can range from our dairy foods like cheese, milk, and yogurt, ice cream too, but also some non-dairy sources, soy, broccoli, spinach, almonds, plant-based milks, soy milk, almond milk. The key though is that you or your child is consistent, meaning having these foods or drinks every day. So remembering if one day is really high and then the rest of the week is kind of lower, you may consider having them take a supplement so that it's, again, consistent, give or take. I mean, if one day is not so good, don't stress, but we want it to stay consistent throughout the day. And vitamin D, this is just an average range, 1,000 to 2,000. Sometimes you need more, so just make sure you talk to your medical provider about the amount that you or your child needs. But vitamin D is super important. Your body needs the vitamin D to absorb the calcium. So just making sure to have these, again, go hand in hand. And supplement is a main way to get that vitamin D in. Most foods, unless they're fortified, won't have vitamin D. So our milk usually will, and eggs. And then again, some foods are fortified, but for the most part, we need that supplement. And in regards to calories, so this is a subject that I don't always talk about with patients or their families because it is so individualized. So calories are our body's energy source. So when we're moving, we need a bit more. It depends on a movement, age, growth. There are so many factors. And usually we just use the resting energy expenditure, so that's the REE, and we can times that by an activity factor. 1.2 is just an average activity factor. Typical movement, not doing anything crazy. But then as things may slow down, we would have to adjust that. And then when we're not moving, we want to do 80% of that resting energy expenditure. The issue with this is just predicted. There's no one size fits all. Indirect calorimetry, which this photo here shows this woman doing indirect calorimetry, is the most accurate way to determine one's calories. So it takes in the oxygen you use and the carbon dioxide produced, and it comes up with the number of calories one needs based on their individualized needs. So with these studies, and there are only several with DMD, but with these studies, they find that at least 10% less calories compared to using that predicted REE equation are needed for both ambulatory and non-ambulatory patients. So that's very interesting. Again, this is a newer topic, and not every clinic has this, and still trying to kind of tweak what's best and not, because breathing matters. Not everybody can give that breath that is needed for this machine. And again, it is very individualized and is not always appropriate to stress about. Every day is different, everybody's body is different, so stressing about calories, counting every single little one, it can not be appropriate for a lot of people. Some other challenges that can occur, especially as we get older and as the body changes, early satiety, so meaning getting full faster, can happen. And then when that happens, whether your child or you are like, I just can't finish my portion, a lot of times you may not meet your nutritional needs, or your child may not meet their nutritional needs, meaning they may not be able to get in enough protein. They may not be able to get enough calories in general. So that's very important to pay attention to. And then other GI issues can occur with that, like delayed gastric emptying, meaning things aren't really going down so easy or settling so well. Less independency, meaning we're struggling with more of that upper body function. You're not able to pick up a glass or your fork as well, or you need some more assistance. That can lead to maybe not taking in so much nutrition, or you're having to ask for more help. And it depends on how you feel about that, but that can lead to, again, undernourishing yourself or decreased fluid intake, which is again going to lead to some other complications, of course, increased risk of constipation. And then not being able to feed yourself can lead to, of course, less eating opportunities. So really decreasing the potential to not get in enough nutrition. Kidney stones tend to be more common too, especially with supplementation use over a longer period of time. And then swallowing difficulties may occur, or fatigue with chewing. So when the time comes that someone might need some more nourishment, there's several factors that are considered. As I mentioned, like excessive fatigue with chewing. If you're taking so long to finish your meal, kind of need to spit the food out, you're just chewing and chewing, you're like, no, it's just not going down. If these things are interfering with getting in enough calories, it may be time to consider, what else can I do to get in nutrition? And of course, if there's swallowing difficulties, it would be important to consider getting a modified barium swallow to make sure that there's not dysphagia going on or difficulty swallowing. And then again, if you're not able to get enough calories in, you're noticing excessive weight gain in yourself or again in your child, excessive weight loss, that would be something really as a red flag to say, wait a second, they may not be getting enough nutrition now. So tube feeds can be very helpful. Just because you go on a tube feed does not mean that you cannot still eat or drink something by mouth. That would be your main way of getting in enough nutrition, but then you still enjoy whatever foods and pleasure foods, drinks that you like a lot of times. But it kind of gives you that security of, you know what, I know I'm going to get in enough nutrition, and now I can just enjoy the little bit that I want here and there. But some challenges can be traveling with tube feeds, especially if you're clinic or you just want to go on vacation and it's a bit of a distance, or especially if you're flying, there can be some challenges there. So making sure that you get a letter from your medical doctor just to explain why you need these liquids and medications, of course, too, when traveling, especially by an airplane. Having everything in like the zipper plastic bags can be super helpful too. So then you can just have somebody pull them out and be ready for that security, airport security. And then with the tube feed, making sure you're staying in a hotel that has like the mini fridge or some type of refrigeration. Unfortunately, with that, you may need to opt for, an upgrade, a suite or whatnot. A lot of them, though, do have more of at least a mini fridge, but it depends how much product you need and how far you're traveling. Now, a lot of times, though, you don't need to refrigerate the tube feed, like if you're giving it in that moment. So that's not something that you need to do, but if you're one that is doing like a carton and a half, and then you don't want to waste that extra carton, that may be appropriate to, again, put in the fridge. Side note, you don't want to give the cold tube feed though. You want to make sure it sits out for a bit before you do that. That can cause some GI distress. And you may consider also preventative actions of packing an extra carry-on just in case your luggage gets lost. You don't want to be not having those supplies with you. So thinking about even like 2 days worth of supplies just to be safe. And always making sure too that you have that emergency plan in place. So kind of to summarize everything all up, what does healthy even mean? It can be very confusing. And the most important thing I like to tell everyone is just like being honest with yourself, listening to your body, when you feel full, what you're craving even. These are all important factors. So focusing more on your energy, your mobility, if you're noticing I'm eating these foods and you know what, I'm noticing some weight loss and now I see like the excess weight really helps me be able to move better. Those things are far more important than just focusing on that number on the scale. And then mentally, noticing when you eat well, that mentally you feel so much better, your brain is more clear. These are things, again, that I love for people to focus on far more than that number on the scale. Saying enjoying the foods with friends and family, it's bold here. I wish it was more bold because I think this is so important. Like, you need to go enjoy, especially the holiday time. You need to enjoy time with your friends and family. We're not worrying about, these here and there days, birthday parties, whatever it may be. Like, you're enjoying those times. Eat the ice cream, eat whatever it is that you're craving, and remember that the guilt doesn't need to come with that. Remembering too that, enjoying it means actually paying attention to the food you're eating. Another thing I like to point out too is if we're so focused on doing this perfect diet and then we notice, but I crave something here and there, like the chips or something, paying attention to, did you not have anything crunchy throughout the whole day or throughout the whole week even? And that might be why you're craving something like that. So that's really important to, again, be honest with yourself and pay attention to, and there does not need to be guilt that comes with that. Getting the whole family on board is super important. So parents, remembering that this is not about just one person. This is about all of you. You all doing the same thing. You're all supporting. You're the support system and you're there to help. But you should also be doing it as well as the other kids in the family or anyone else in the house. We want to make sure that it is support, not pressuring or perseverating on weight or, again, certain food choices. And thinking about, if you're frustrated with your child and, oh, this, they always choose this option or whatever. I mean, if you have it in the house or you're offering it or you're eating it or the other kids are eating it, we can't really blame one. So just again, as a family, being honest with yourselves too. Overall, thinking about a Mediterranean style diet can be what is most balanced. And just thinking ahead, I think that's important in the sense of, as I mentioned earlier, I talk to families when they're starting steroids or about to start steroids. So this may be kind of a weird time to talk about some of these things we just discussed because the family's like they're 4 years old. What does some of these things matter? But when we start to educate early, a lot of these habits can sink in earlier, and it just makes it so much easier down the road. Parents are able to be more preventative. For example, we think about we're starting steroids, those increase hunger. Your child's going to get more hungry. A lot of times when we're hungry, all of us, we're going to go towards the carbohydrates. When we have the carbohydrates, most times, again, we're going to maybe gain excess weight. And if we keep that pattern going, again, it's kind of a chain reaction. So it can be really great to keep these things in mind early on, not perseverate on, but just remember that a lot of them are more chain reactions when it comes to nutrition versus something to think about, oh, I have, 5, 6 years to think about that. And just, I do want to go back though, just to mention again with making sure the whole family's on board and the support system. I think that's really huge in the sense of sometimes we don't realize that we're pressuring, whether it be your child or you're pressuring yourself, right? And that can lead to some negative thoughts, and eating disorders or disordered eating. That is a thing. So really making sure that again, we're thinking about that balance in a, in my opinion, good way. So this is what I like to show. Most days we're going to try to do the plate you see. I don't know what side it is for you. For me, it's the left side. I hope it's the same. Um, and then some days we're doing whatever we feel like. So just remembering that. Again, it's about having fun and enjoying that balance. And I believe that is it. Thank you. Oh, I think you're muted.
See,
There you
I was what happens when I don't do things I usually do. Anyway, Marla, thank you so much. I truly appreciate you putting that together. I actually have a question for you before I get to the question and answer piece.
Yeah.
So you said that you typically see patients when they start steroids.
Hmm.
So for families that have chosen not to start steroids, when do you think would be a good time for them to ask to, because I still think it's important, even if there's still other medications, right, that can be, um, that nutrition and diet can help. So in those instances, when would you recommend families ask to get a consult with a dietitian?
Great question. So sorry, I may have not communicated that the right way. On one of my slides, I think I wrote that starting steroids more so as I would spend a bit more time with them on that topic. But I see everybody who comes to our clinic. Um, Sorry, you can't opt out. No, I'm just kidding. You can, but please don't. No, so you're absolutely right. I see everybody who comes just again, like what I say is my checklist because we can all go through those things and like I'm good, my kid's good, like we're doing great. And then I kind of take those comparative numbers, again, with the protein amount, I'll see what their weight is at the clinic and be like, okay, this is the amount we're kind of aiming for. You gave me a food log or a food diary, and let's see kind of how that compares, guesstimating and whatnot. So either way, I see the patient. So I think it's important that you at least see the dietitian. I'm not sure how often everybody goes to their clinics. We have 6 months and a year follow-ups, but I would say at least see them once a year just for that, again, checklist. Make sure you're not falling off track of anything. Sometimes we forget things when we're in our day-to-day.
We can always use check-ins and reminders and all of those things. So I absolutely agree. Um, so we do have quite a few questions. So you had talked about almonds in terms of like protein.
Mm.
Soaked or dry, or does it matter?
Yeah, great question. In terms of protein, it does not matter. Um, and same with in terms of calcium. I don't know if that's what somebody else was thinking as well. Um, they tend to be a good source of calcium either way,
Perfect.
and protein.
Awesome. So this is just my spin-off question. So
Mhm.
almond milk though, like what would that look like? Would you just look at the nutritional value?
Yeah, usually almond milk is a good source of calcium, not so much protein. So, great point to bring up. So, almonds, the food, is a good source of protein, fiber, and your calcium. Almond milk and oat milk, those are going to still have the calcium, but they don't have so much protein unless you get a fortified one. I believe Silk makes a fortified almond milk. And then if you are looking for a plant-based substitute, soy milk would be a good one for both calcium and the protein.
Perfect. Thank you.
And
How,
pea milk. I don't know. Some people that's kind of a newer one, but I believe like Ripple is one of the brands of like a
oh, I've
pea
seen that one.
milk.
Yeah.
Yeah, so that can be a good option too.
Awesome. That's good for me to know for myself too.
Yeah.
How can I manage issues with kidney stones when taking calcium or sorry, when talking calcium supplements? Is one type of supplement better for this? Calcium citrate versus calcium carbonate?
Yeah, great question. So the amount of calcium would depend on more your provider. A lot of times they decrease the amount of calcium you're taking for a supplement, depending on the kidney stones. And if you're already taking in some sources of calcium, I don't know if you do food wise. So just being mindful that they may decrease that just to, again, prevent those kidney stones from reoccurring or coming back. And then the citrate is going to be more of the like absorbing type. So that would be more of a question I would check in with your provider to make sure that you're not overdoing the calcium. A lot of times I notice at least that they decrease the calcium supplements just to be on the safe side. And again, especially if you're already taking in some calcium sources, you may just consider discussing that with your provider as well to make sure you're not overdoing it. And then either way, really stay hydrated. Be mindful of the sodium. And then when you can add like some lemon or some citrus to your water, that can really help prevent reoccurring kidney stones as well.
Perfect. Any tips to manage issues with food sensitivity?
Um, they might need a second to get back to me, but I don't know specifically what it is that you're thinking of sensitivity wise in kind of what age maybe you are or your child is. I think those factors matter as well. So if it's more of GI, like diarrhea or looser stools. Want to also consider medications if this is something newer. Did your child just recently start a new medication or an increased dose of a medication? That could be causing an issue. And then if it's something that they've been kind of living with for a bit of time and it is kind of along those same lines of, again, the looser stools or whatnot, you may consider being mindful of if they need to kind of have a rest, meaning more of like a day of more of that white rice, sweet potato, banana, which is kind of like a brat diet to allow their stomach to rest if those are the symptoms they're having, versus if it's more of gassy, bloating, constipation, that could be related to not enough fiber, hydration. And some of that, though, in regards to the constipation, is going to just be typical with DMD because, again, that requires some muscle. So just being mindful, do I need to have them take Miralax or, a fiber supplement as well? And that would be something to discuss more with the provider. Another side note, though, is I do say to be mindful if you're more doing a vegetarian diet and you have a lot of lentils, quinoa, stuff like that. Sometimes that excess fiber can actually cause some of those symptoms too, especially if you're not staying hydrated. So just be mindful of that as well. Too much fiber can be a bad thing, and too little can also. So it's that fine line.
And then to um, expand off of that a little bit, What about, like physical food sensitivities, not necessarily gut related, but for those, that are sensitive to maybe textures or things
Right.
like that? I don't know if that's the question, but it's a question that
Yeah.
I have based off of that question.
Yeah, no, that's a great point. And yeah, there are a lot of um, kids and adults with that. So thanks for bringing that up as well. So I'm not sure again how old, but looking into um, like feeding therapy, depending on how severe this is, can be super helpful. It depends where you live, but there are some clinics usually in certain areas, and hopefully you wouldn't have to travel too far. If you feel that your child or it's you, you can't eat a certain food, your favorite food, when a different food that you hate touches it. If it's on the same plate and your child's not eating the food because other food is touching it, it's kind of a red flag. If say you or your child, like somebody asks you, hey, can you pass me that food? And they're not willing to pick it up with their hands, that can also be another sign of, wait, maybe we need a bit more help here. So it depends how severe things are, but you may consider, especially again, it really doesn't matter what age. Unfortunately, this is something that hasn't been really caught in the past. So there are, people who are older, like 25, with these issues as well. But feeding therapy can be very helpful with that. And if it's more of like a selective eater, so if you're saying like, no, no, that's not their problem, nah, they'll still eat their favorite food, it's fine. Um, just thinking about the division of responsibility. Ellen Sattler, I believe is her name, and you can look her up. She has some great tips on your role and then your child's role, and remembering to again decrease the stress after your role stops so that your child doesn't feel over pressured or overwhelmed with things. And from it being, they take just a bite, a lick, whatever we may call a touch, you won. And remembering to kind of let it go there so that this isn't something that you perseverate on and cause some discomfort with them. Again, unless it's a bit more severe than that and they may need more help. Things you can do too is like have them be more involved in the kitchen. Whether, again, they just grab the broccoli from the fridge, whatever, when if they want to actually help, cut it up or do something with it, great. If you want to make it, depending on how old they are, you could do like a craft with it. Like, here's our broccoli tree, let's make people with the carrot sticks, make it fun. Or if you're really wanting them to try something new, it can be, let's go to the grocery store if that's what you're okay with them doing with you, and they pick out a certain fruit, vegetable, whatever it may be. Or they just, you're scrolling online and you guys find one that way too.
Perfect. This is a good question. Can hair loss be linked to nutrition deficit? And if so, in what, if you can answer that?
Yeah, most definitely. I'm not sure if this is something newer. And for you or your child, if you've noticed any big changes in their diet, that would be something really to think about. Like if they're starting to have smaller portions, if they've eliminated certain foods, those are things to just consider. And as for what vitamin or mineral, it could be many. Again, I would say it depends what has kind of been eliminated. It could be more of like the B12 vitamins or the B in general, which would be more from like your protein foods. It could be like a vitamin D, if again that was something that they were taking before, not so much anymore. It really depends. There could be a lot of reasons for that, and I would say just assessing when this started and what maybe changed at that time would be a great place to, you know, um, begin to kind of tackle that. And it wouldn't hurt to take like a multivitamin, for example, with minerals or something of that sort. But I would definitely bring that up with the healthcare provider to kind of figure out more.
Yeah, I would definitely make sure to coordinate with your clinic specifically.
Yeah.
We have like a three-tiered question, so
Okay.
here we go. Um, what about kids who are older, non-ambulatory on steroids, and have bone infusions every 6 months? Anything or any special instructions during these infusions?
Yeah, absolutely. Usually that's a time that they need to take more calcium. And I'm not positive. Usually the medical provider will tell you exactly how much, but usually it's a significant amount more. So, for example, like I have seen patients who are taking like um 2,000 milligrams or 1,500 to 2,000 milligrams of a supplement, and then they're also having, dairy sources, but it's only for a short time. You again, talk to your medical provider, but for example, a week to 2 weeks before and then kind of following that, a week to 2 weeks after, is something that I have seen, but it likely depends on what type of infusion, and what your provider feels is best based on probably your bone health from previous, and hopefully they have some type of scan to see what that, where the progression has been going with that.
Perfect. Anything in with what you're seeing? Excuse me, sorry. I'm also sick, so I feel you in a real way. Vamorolone Agamree. So I know that there's been, questions around, bone density and it's supposed to help and all of those things. But have you in your practice, I know it's newer too, but have you seen anything or had any recommendations for those specifically on Vamorolone Agamree?
Yeah. So not fully. I mean, again, like you said, it's newer. We have noticed an increase in weight tends to be something that can happen. So really being mindful of that. And so with the weight, if you or um, you know, your parent is noticing, you as a parent are noticing that, thinking about where you could slightly decrease the carbohydrates would be where I would start slightly, meaning like 25% less of the rice or whatever it may be. So just be if you're able to do that and notice like, oh, they're gaining a lot of weight, try to start that preventative action there. And then just thinking about if somebody is getting taller, they might be at increased risk of contractures. So just being mindful of, again, the bone health and getting in the calcium and vitamin D needed. But a lot of times we are seeing what seems like a bit more of a weight gain occurring. Oh, I think you're muted. Sorry.
That's okay. Anything to watch out for when we start drugs like Duvizat or an HDAC inhibitor?
Hmm. Yes. The diarrhea, I feel like, unfortunately, so many people say. That's like the main side effect I feel like that tends to occur. So and obviously with that too, understandable, though it could be not related to that. They also like nausea or less of an appetite tends to be something that I hear. So with the diarrhea, if that's what's happening, really make sure you stay hydrated, get your electrolytes in. Perhaps you need a break, or again, talk to your medical provider about maybe the dose decreasing. Obviously, if you're going to school, that's not something you want to deal with. And seeing about maybe the time of day, that might help as well, but that would be something to adjust with your medical provider if you're experiencing that. And then if you're having more of a nausea or kind of food aversions, meaning you don't really like some of your favorite foods anymore or whatnot, um, trying your best to think of ways to get the food sources in. A lot of times people can do more like protein drinks to help. So that could be an option if you're, noticing like, oh, I'm skipping meals or something of that sort. Sometimes drinking can be a bit easier than eating the foods.
I keep muting myself and then forgetting that I'm muting myself. Last question that we have, but if anybody does have any questions, please feel free to put them in that Q&A box. I am also monitoring Facebook and the chat. But an older individual, what are some ways to manage GI issues with tube feeding? Is a peptide-based feeding better?
Yeah, great question. Um, so looser stools are normal with a tube feed. Um, as in, it shouldn't be watery, but looser is somewhat normal. If you're noticing that, I think that's important to know. If you're having more of like gassy or GI pain, it could be the rate of the tube feed that's affecting you. And if you've already kind of tackled those things, and you're okay with experimenting with another one, the peptide base may be helpful to try. A lot of times I feel like, again, it could be a lot of times the rate of the tube feed that like, how if you're doing a bolus, maybe you don't need to do a whole carton, or if you're doing continuous, you need to decrease the rate a slight bit. Those can be very helpful. And if you're doing a bolus and you're noticing like the gassy or distension and whatnot, or you're having like a bowel movement right after, it could be that you're doing the bolus too fast or that there wasn't enough time in between the last one. So those are some things to just be mindful of. A lot of times with the bolus, those are usually okay depending on what type of tube feed you have. Because, for example, like most are around like 250-ish calories. And if you think about eating, we usually eat more of than that in one sitting. So it should be okay. But if you had one only like 2 hours before, maybe it's just a bit too much on your stomach.
Yeah, absolutely. Well, I don't have any other questions that I see, but Marla, I want to thank you again so much for doing this. I think it's so important. If anybody does have any questions, I know sometimes it takes a second to process, or if you're watching the recording, please reach out to me. I will get the questions to Marla and get them answered if possible. So, with that, I want to thank you again, Marla. Thank you guys for being here and listening, and we will see you all again soon. Our next webinar will be December 12th. It is on the clinical trial journey, so make sure you check that out. And we will see you soon. Thank you so much again.
Thank you all.
Have a good day.
Bye-bye, you too.
Bye.